Hello, good morning, everyone. This is Bridget Danner, and my guest is not here yet, but I wanted to come on and welcome you, and at least we can do a little introductions. So I said in my newsletter that I wanted this to be sort of based on, your questions and what you're here for today. So you are welcome in the chat to let me know what you're here for today. What brought you here today? What questions can we help answer? So we had Lauren on a few months ago, and people were really interested in the thyroid. So we thought we might sum that up a little bit again. That's one idea. She was also interested in talking about peptide, a nasal spray for mold. That is one option for mold that she gets questions about. And then we thought about talking about weight loss as well, because I feel like a lot of, I don't know if controversy is the right word, but a bit of a trending topic. Probably weight loss is always a bit of a trending topic. And it's often the topic of like, is whatever is now popular safe and healthy or not? So, yeah, those are our thoughts. Anything you particularly would like to talk about today? We could also talk more about mold, other aspects of healing from mold, how the mold interacts with the thyroid and weight is fair game too. Just checking on her. Or if that's all too much to share, you're welcome to just share where you're from. So I'm here in Arizona. Thank heavens it's cooling off a little bit, even though it's still August. It's been nice to be a little tiny bit cooler. Trudy said, deep dive into thyroid and VIP. Great. Yeah, I don't know much about VIP myself. So I'm excited to learn more about it as well. Like I know a little baby bit about peptides, and I think they're very exciting. But because I can't prescribe them. Well, partly because I can't prescribe them, partly because they're still kind of new on the scene, really. I don't know as much about them. Although I did find some peptides over the counter, like oral peptides that I can sell in the shop, but I don't feel like I have the knowledge yet to be selling those. They're kind of spendy, and there's a little limit on what all I can carry. There aren't that many options, but I thought it was kind of interesting, especially because sorry, she's trying to, I'm not tolerating the peptide injections anymore. I think it's something about the substance. So oral sounds intriguing to me. Okay, she's coming on. Thanks for your patience. Trying to think of some other announcements. Well, my biggest announcement is that our new shop is up, and I'm super excited about it because we were able to carry a lot more stuff and a lot more affordable stuff. We were really feeling limited in our growth than what we could carry before. So I'm super excited about that. And if you haven't seen it, I'll put that in the chat. And we have most orders are going to be free shipping. There's a few little exceptions, but mostly that's going to be the case, which is awesome. And we have a code, a savings code for your first time shopping which is also nice. I'll put that in here. And we're able to carry a few items like castor oil packs, red light pads, little ozone machine, few little food items, and then lots of stuff. But it's just exciting to, have some supplements that are kind of beyond detox and supporting some other things. So we have just like more options for sleep and exercise recovery and that kind of thing. So let's see what she says. Oh, there she is.
Good morning.
Hi, how are you? Can you hear me?
I'm in the show, but let me make sure I don't know why I can't hear you. Talk again, Bridget.
Can you hear me now?
Yes, I can. Yes, I can.
Okay.
I'm so sorry to be 6 minutes late for you. My goodness.
That's okay. I was just giving a little introduction. We just got one comment so far from Trudy. She said yes to thyroid and VIP.
Awesome.
Yeah, let's see. So where shall we start?
It's nice to see you, by the way. Good morning.
Yeah, your clinic?
Yes, yeah, in my office.
Well, let's start with a bit of that. You don't have to give your whole history, but maybe just share what kind of things you see in your clinic and your approach to working with people.
Yeah. So I consider myself, I guess, an eclectic family practitioner. I see a lot of various things, but quite a bit of traffic comes my way with regards to like hormonal optimization, in particular thyroid care. I've done a lot of work around thyroid care for probably my focus the last 12 to 15 years. And then I have a lot of personal history of course, anytime we have personal history of concerns, we tend to even dive deeper into those, conditions and those journeys. So yeah, I work around a lot of hormonal work, and I have in the past, probably, I don't know, maybe 5 to 6 years, gotten more interested in like longevity and optimization and really just the various tools that exist and are constantly surfacing to allow for people to not only overcome, but to thrive beyond that. So
yeah, it's really changed a lot. I'm going to be in a friend's perimenopause summit in like a month. I was recalling I hosted a perimenopause summit probably 8 or 9 years ago, and I feel like in that span of time, the entire landscape has changed. The entire thing.
It's
like
wild.
what people are talking about now, like no one was even really talking about on that summit. So it's exciting. It really is. And I just love, I'm a little jealous sometimes the NDs have such a nice scope of practice it's just more tools. It's a lot of things to play with. So it's really exciting. Okay, so last time you were on, we took a lot of kind of questions all over the place on thyroid. So I thought it might be cool to just like sum it up, like some basic things like when to test, how often to test, like, how to look at your numbers. I don't know, whatever you think is important for anyone with a thyroid to know, as they go through life.
Yeah. Yeah. And I think that was one thing that seemed to get a lot of hits was just even the testing, like in starting this process, what are you going to be exploring and what to ask your doctor about beyond just basic blood work to explore if you have, any underlying issues. So, I mean, is that an okay thing to kind of go through like lab work wise?
Yeah, get in there.
Because of course there's the standard, TSH, and then we'll get lab work and parameters, but TSH, and then I always request like a free T4 as well as a free T3. And really understanding those values, it gives information on our end, the clinician's end, of not only like how is your thyroid functioning, but then from a peripheral standpoint, what else could be affecting your thyroid functioning optimally. And that's going to get into toxicities and, gastrointestinal health and in chronic inflammation and stress and things like that.
Okay.
yeah, getting to a big picture there. And then antibodies is great to look at, even if you've had them run in the past. Sometimes those will pop up if you're, going through something. So understanding like antithyroglobulin antibody, thyroperoxidase antibodies.
So just to recap what you said so far, are you saying beyond TSH, do more thyroid markers, do antibodies, look at inflammatory markers, maybe test for gut health, or at least talk about it with your practitioner, that type of thing, screen for it?
Yeah.
Okay.
Yeah.
Do you want to talk about those interactions? Because, yeah, it is. I mean, I think when I first studied the thyroid, it was a lot to learn. I'm sure it's how you felt, because it's not like just so simple. It's also how does it convert, and like you said, toxicity, then gut health. So can you explain some of those interactions?
Yes. So, and that honestly, once I started to grasp really understanding like the remainder of the body's impact on thyroid function, that's when clinically I was able to see a lot of jump in just treatment. So and I feel like probably your community is pretty familiar with T3, free T3, reverse T3, like those terms. If anyone has questions around more detail with that, please let us know. But as far as the T4 inactive form of thyroid hormone, that's the majority of the thyroid hormone converting into T3, which is active. There's a lot that's involved in that enzymatic pathway, right? That enzyme can be blocked, impacted by a lot of different body processes. Cortisol being one of them. If cortisol is in excess or imbalance, that can go in there and block that deiodinase enzyme. So you can, have a lower amount of conversion to T3. And it's not because you necessarily need more thyroid medication or, you're not doing right there. It's that you need to search elsewhere, and where else can you really start to do some work to allow for your thyroid to function better. So stress is a huge one. Gastrointestinal health also. I mean, the gut's like the origin of all the things, right? Like we all talk about that. Yeah. Immune and inflammation and everything. So often when I see a T4 to T3 ratio off, not optimal, and typically T4 to T3 ratio, like a 1 to 3 numerically. So if that's off, that's where I start to ask more questions. What's going on in your life? What are your habits and behaviors? What's your stress level? Can we dive into more gut health conversation, things like that?
Okay, so could be any kind of issue creating the
It can be a
conversion.
lot. I mean,
Okay.
toxicity as well, be it mold exposure or environmental toxicities or, just any body burden can really affect all biochemical pathways. So,
Yeah, I guess what I see the most in mold, although it's not the only pattern, but I was shocked to see how much there was mold, which affects gut health and immunity, and then Hashimoto starts. I've
yeah,
seen that so much. And
yeah,
that happened for me. I found that out before I even found mold. So I don't think it's the only pattern, because yes, the gut is stressed, and there's obviously toxicity in the body, and the liver is stressed. But yeah, I think that mold really can open the door for autoimmunity, the way it kind of scrambles the gut and scrambles the immune system. So something, I think, if you're listening and you're going through your mold journey, I think it's very worthwhile to have the thyroid checked to know where you're at now. And then if you need to kind of have a goal of how you're going to, positively affect it, work with a practitioner like Lauren or myself on like, okay, how's your gut health? How's your stress? Like, are you getting out of mold? Are you doing the detox? Because you don't want this pattern to like run wild for too many years without knowing about it.
yeah, yeah. Well, and it often feels like conversations I'm sure you have with your community. It's like it almost indirectly treating thyroid. It's like, wait, why are we focusing here? But it's tremendous impact on just lessening the overall hyperimmune response. Just addressing some gut health and some stability there. So, yeah, it's
Okay.
not the first line thought, but it's huge.
No, it's definitely like being affected rather than the start of things. But if
Yeah.
it's being affected and you don't know it, and you're sleeping all the time, and you're sore and your hair is falling out, like, if you don't know that's going on, then you're just at a little disadvantage to not be able to think of it in the right way and track it. So,
Yeah.
well, let's talk about the mold a bit more with the VIP spray, which I don't even honestly know really what it is. So.
Well, yeah, yeah. And peptides are such a fascinating realm that because they, typically kind of come onto the scene for a purpose. And then in using, there's then all these other, purposes to then your applications for them. So one peptide isn't necessarily going to treat one thing. It does various hundreds, if not thousands of different types of benefits. So with VIP, I mean, typically historically that was used for like gastrointestinal integrity, right? So vasoactive intestinal peptide, it's something that we have naturally occurring in our system and often gets depleted when we're chronically inflamed. And so using this and typically in how we've used it clinically is like a nasal spray, but it's essentially to treat or correct for the chronic inflammatory response syndrome, which coincides with, I mean, mold exposure. That's just kind of what manifests, right?
Yeah.
So it's back to like gut integrity and gut health, kind of restoring some resilience there can allow for your system's inflammatory response to start to downregulate and help that. So from an
Wow.
inflammatory standpoint, it can be really tremendous.
Wow. Okay, that sounds really exciting. So it can help for like leaky gut, inflamed gut, plus just system-wide inflammation?
Yes, yes. So
Okay.
big in the mold, but also in lots of various inflammatory conditions. Yes.
Does it help right there in the nasal area as well?
It does, and it can help with like neural inflammation, a lot of that, be it, brain fog, cognitive decline, those types of symptoms that often accompany, toxin exposure. And it acts systemically as well.
Okay. Awesome.
Yeah.
And is it only through certain naturopaths that are into this kind of thing?
It's available to practitioners. So it's just
Okay.
and so let's speak to peptides for a bit. The peptide landscape is continuously shifting. Just either what we have access to or, what compounding pharmacies can make. And then there's new things popping up often. So every practitioner has access to it. It's just whether or not they're familiarized or set up with a pharmacy or that type of thing. So it's in my bubble it seems to be used often, and I don't think that a ton of people are using certain tools.
Yeah.
So, but it's easy to get for sure.
Okay. Okay. It sounds really great. The brain stuff is tough, and even though I'm just learning about this, I read and recommended other nasal sprays because they just cross the barrier so well through the nose.
Yeah.
So for like brain fog, and then so many mold people, most all of them, if you've been in a moldy building long enough, you're going to have kind of a dysbiosis in the nasal region.
Yeah.
And then possibly some antioxidant deficiency there, melatonin deficiency. So yeah, it's a really important area to treat. When I was an earlier practitioner, I didn't fully understand that. I did like salt washes for my nose, but I didn't understand what an important area the nose is for mold people. So that's
What a
awesome.
great route. And then one other interesting application, which is newer for me for free use, but the VIP, there's and mechanistically, I don't have the entire mechanism down, but it's great for circadian rhythm reset. So for a lot of my insomniacs or clients that have a lot of sleep disruption, especially with traveling, be it internationally or cross country, it's great for reestablishing circadian rhythm. You had mentioned melatonin and things like that. So again, as we use these tools more and more, benefit is being, I think, realized. And so that's another means for use is,
Oh,
which I thought was
yeah,
fascinating.
maybe because of the way it's affecting the brain, or maybe
Yeah.
the melatonin factor in the
Yeah.
nose. That's really
So that
interesting.
was kind of cool and newer on the scene. If any of your clients are super interested in talking more on that, absolutely. Like I'm still diving in, but it's been great for the few clients I've used it with. So
That's
yeah.
awesome. Okay. I was trying to look up, a friend of mine is recovering from mold and is starting like a different therapy. And I wish I could remember. I'm just like hoping something will pop into your mind. It's not a
Yeah.
peptide. It's like, I was trying to see if she texted it to me, but she's like, "Oh, you haven't heard about whatever."
Oh, shoot.
It's like an expensive, I think, kind of specialized. It's not peptides.
Not like exosomes or not like,
Yes, that's
ah,
it. What's
well,
that?
there you go. Well, shoot, we just brought that in a few months ago in
Okay.
our practice. Yeah. Well, okay. Exosomes are a whole nother like frontier of fascinating tools. So exosomes, to my, let's try and explain it. It's in the stem cell kind of region, and essentially it's not a stem cell in and of itself. It's the like the messenger chemicals that are released from stem cells. So they have a
Oh,
lot of what's called like pluripotent. They have a lot of capabilities to really go in and heal tissue in any area. So there's different ways to use them. A lot of practitioners are using them like intra-articular or joint wise for healing, cartilage, ligament, bone damage. And then more recently, we've been playing with using it intravenously. And essentially it travels out into your system. If we think cells, when damaged, put out receptors for healing, right? So the exosomes will travel to those sites and like latch on to receptors and start the healing process. So
that's
it's,
really cool.
yeah, it's
See, when I get
very,
jealous.
very, it kind of sounds magical, but it's
So smart because it's like, you're taking a small part and replicating an action, like the
yeah,
signal. It's so smart.
yeah.
Okay, I'm really
And there
excited
are,
about that.
in vials of exosomes that you use, there's anywhere from 50 to 100 billion, particles. So it's a powerful treatment. It is not, it's pricey, but it's something that you can do, once or twice and have some pretty tremendous. I mean, there's been tremendous stories I've heard of from MS recovery to, seizure, decline in resolution to, lots of neurocognitive types of things, but it's great for inflammation as well. So chronic
Okay.
inflammatory processes. Okay, so your friend's looking into that. That's cool.
Yeah. I'm really excited. Okay, so let's actually talk about some price of things because I wanted to kind of ask that with VIP. So outside of visit costs, what could people expect with like a VIP prescription or a exosome treatment cost wise?
Peptides are they're not incredibly expensive. If a lot of my clients are used to compounding formulations because we customize, be it hormones or thyroid or whatnot to them. So typically prescriptions can be, anywhere from $90 to $120 for like a 3-month supply. So it's not,
That's not that bad.
right? And then
Yeah.
peptides are pretty comparable, dependent upon,
Wait, what was the first thing you said? VIP?
VIP.
Was the 90 to
I
120?
would say within the $100 to $150 realm of
Okay.
usage. And also with peptides, often what they're doing is they're promoting the production of, they're almost like analogs in that they're promoting the production of certain chemicals within your system. So it's not a reliancy thing. This VIP you wouldn't be on forever. It's going to, accomplish a purpose
Right.
over the course of a 3
Definitely.
to 6 month window, and then
Yeah.
you're done with it.
No.
And
Yeah.
peptides you kind of cycle anyways if you're using them appropriately. So yeah, I would say within that
Okay.
realm of hundreds, not thousands.
Yeah.
For exosomes, a whole new ball game.
Drop it. Just drop it.
Right? I mean,
What do you got?
injection wise, you're probably looking at like 3 to 6,000,
Ooh,
intra-articular, and
okay.
intravenous therapy anywhere from 5 to 15,000, dependent upon dosing. So, and again, those can be dependent upon the severity, the chronicity of a condition. You want to use certain dose strategies. And that's I wouldn't say one and done, but that's not like a series of 6 to 10 kind of a thing. It's like 1 or 2 sessions and
Yeah.
pretty significant benefit. Yeah.
And you're using it for things potentially like MS or
Um,
serious situations.
yeah, a lot of the clients that we've used these with, of course, there's a price point. We've done a lot of work and made gained some strides, but we're just stuck, so
Yeah.
introducing that for just another attempt to really blast out some inflammation and
Yeah.
yeah,
Okay, got
so
it.
yeah,
Yeah. Yeah, I mean, some things aren't like your first line of defense price-wise. That's just
yeah.
kinda how it can go.
It's realistic, right? I mean, some clients come in and ask for it out the gates, but
Oh,
yeah, it's
yeah.
great. It's great for a lot of nerve regeneration, chronic inflammation, um, and autoimmunity, absolutely. So
Mm.
the applications are can be applied to anything really, but I'm just trying to think what prompts my thought process and introducing that. Yeah,
Yeah, and we're just talking about a couple options here. There's a lot of other peptides, and they're like Lauren said, more in the you're going to spend a few hundred or maybe several hundred over the course of your treatment, but it's not getting into the thousands. So there are a lot of options out there. When you first introduced me to some new things, Lauren, I was just like, oh my God, if I had had these when I was at my sickest, I just know it would have shifted a lot faster, you
yeah,
know? Um, and it is what it is. And one conversation I get in when I'm doing webinars or something, people are like, totally wiped out financially from mold, which I get. I
yeah,
get. And I get the exasperation, but at the same time, you actually don't have to spend a lot.
yeah,
There's also that option to not spend hardly anything. I'm dead serious. Like being outside, getting sunlight, grounding, meditating, dry brushing, like that's basically was how I got better.
yeah,
Um, I excited for these tools because I think they are faster and maybe more profound in some senses. Um, but I hate to hear people feeling like I can't get better because I don't have the money.
yeah,
Like
yeah.
not true. It's not
And
true.
sometimes too, these tools, you know, you can use them for short stints of time to allow for you to get to a point where you feel like the energy, the incentivized, like you're motivated, you're driven enough to do the things that we need to do every day, right? Because we all need to wake up, drink water, get our lymphatics moving, sunlight, positive mindset. It's just when you get so down, it's like, ugh, how do you
Yeah,
get
that's
there?
true. Just
Yeah.
kind of a bridge to get you through so that you have the energy for those things. That's a good point. I mean,
Yeah,
that's
but I
go ahead.
totally agree with you. It doesn't need to be, money's the barrier. Yeah.
Yeah, and I think I said on our last call together, that's sort of how I felt when I met you as a client, because I was having healthy habits, but I was like, why am I suddenly so much more tired, sleeping 12 hours? Like, this is not, I need, I need a second opinion, right? I need some new tools because my tools aren't enough right now. Um, and I was just so thankful to like find you, give me some better insights on my lab, give me some new tools. And I was just so shocked at how fast the peptides helped me. And we changed some other things too, my thyroid medication and a few things. But I mean, you literally couldn't have told me that I would feel better that fast. I think in like a month, I was like, just recheck my labs. I'm doing so much better. Remember?
You just
I
need a
mean,
little tip. Yeah.
it's
Yeah.
it was insane.
Yeah.
And yeah, I mean, it's expensive for me too to do that, but yeah, I'm not even doing it now. So, because I don't feel like I need it.
Yeah.
And your body kind of tells you oh, you still kind of need it. And then it's like, nah, we don't need it as much. So, um, yeah, it's also kind of that intuition of, there is discernment to be made with your treatment plan. I don't want people spending their last penny on exosomes if that's not the stage they're at, if that's going to cause that's going to cause them to lose their home or something. I want them to, every case is different. And then, yeah, I think you can listen to your body and what's speaking to you, like what's really calling to you from a place of like curiosity rather than like a place of like fear, like if I don't do this, I've seen that too, and I'm sure you do, Lauren, like
Yeah.
if I don't see this certain practitioner, I'm not going to get better or whatever. If I don't do this certain treatment, I'm not going to. Again, not necessarily true at all. So even though we're in a very fearful time, you still have to kind of, open up and relax and know that like you can get better from wherever you're at without, not paying your mortgage. Like you can
Yeah.
find that balance. It's not easy, but it can be
Well,
done.
in speaking on like kind of mindset area, I mean, I love beyond the thyroid labs that we talk about. I love getting a really like good look at labs in general of all the things like other hormones and inflammatory stuff and stress hormones and B vitamins and D, just to really like comprehensively understand what's going on in the system, and then have a conversation about, how we're not broken individuals. We're just in this state of imbalance, and all the tools we've discussed thus far, they're just nudging your system to like get producing what we're already producing. Like it's just repleting things that are depleted due to the condition we're in. Not any, we're not stepping in and fixing anything. So
Yeah, true.
yeah,
Just assistance.
yeah.
True Pretty asks, can VIP be used at the start of mold detox? Here, I can put it on the screen.
I
And
think
does
I
it
see.
help?
I think I did
Okay.
like a comments click. Okay. Yes, it can be used at any point in time. Absolutely. I mean, I think the earlier the better, right? So because if you've detected, obstacle, then get in and start creating some healing. And back to what the VIP originally was used for, gastrointestinal integrity and gut inflammation. Absolutely, for Hashimoto's, it'd be fantastic for any type of autoimmune process, because restoring the resilience of your gut can be tremendous. And I would say that accompanied by, microbiome work and things like that, right? Just not that alone as a sole tool, but a powerful tool for healing. Yeah.
Yeah, I could, and definitely the Hashimoto's Trudy, because as we talked about, the gut is very vulnerable and influences the thyroid in a very negative way when it's
Yeah.
not healthy. So, and again, at least when I'm hearing, even when I was working on my gut, again, it took forever. And I'm glad I did it. Like my gut is very solid now. It's crazy compared to how it used to be. But I mean, also I had to, heal from mold and all that. But like I probably took me 2 to 3 years of like gut protocols and adjustments and and yeah, I don't regret any of it, but it was slow. And maybe something like this would have made it quite a bit faster.
Yeah. 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 Tell me about it. So my self-diagnosis Hashimoto's was what, 15 years ago or something. And same, Bridget, it was like, oh my gosh, wow, I did a lot of work. I mean, mine was like 6, 7, 8 years of like a lot of gut stuff, be it diet and microbiome work and dysbiosis and all that. And yeah, blah.
Yeah.
So it does it in retrospect. It's like, that was a lot. I wish I had these things
Yeah.
too. Yeah.
Yeah. And that's why sometimes, like with gut stuff, I almost don't, unless I can see that a client is really motivated to go there, I almost like don't. Not to say I don't care about the gut, but I'm like, oh God, how do I break it to you? I'm like, how long this may take?
Yeah.
You've really got to believe in the concept and
Yeah.
want to stick through it. Because if you've done a protocol for a couple months and your labs don't look much different and your symptoms don't, you're like over it,
Yeah.
sometimes.
Yeah.
So yeah, I actually think I'm going to send one client I have to you because yeah, I mean, this whole stuff is a whole new world to him. And I'm like just kind of spoon feeding him a little bit more about the gut every time we talk. But I think if we could, get a shortcut, that would be a nice thing for him, or
Yeah.
another
Well,
perspective.
just to start noticing some result, right? Yeah. Or like, be it metrics or overall feel. I know it's like, it keeps you going. Heck yeah.
Yeah.
So
Yeah. Are you seeing Trudy's next question
I did
here?
the negative interactions with VIP and like mood. Yeah, antidepressants, Ativan, no, not. So again, VIP is something that's naturally occurring. It just gets depleted in chronic inflammatory syndrome. So by no means, in fact, again, back to gut health. Sorry, that's like the theme here, but restoring some integrity can allow for a lot of like neurochemical production, balance and things. So there might even be some improvements in that realm. So no interactions.
Nice.
Good question.
Yeah, because the gut is so important
Yeah,
for neurotransmitter production and stuff.
yeah,
That's awesome. Okay.
yeah. Yeah.
Well,
And I
I
keep
go
going.
ahead.
No, go ahead. I was just gonna say, I keep saying gut stuff and like how to evaluate. I don't know, what do you usually talk, like, is it like stool analysis stuff, or what
It
are
was
what are
good.
the kinds?
Yeah, we usually do the GI map. That's our
Cool.
that's our test of choice. And I don't think any test is perfect.
Yeah.
But I think it can give us somebody with very confusing, chronic symptoms, at least something that is a little more tangible.
Yeah.
And, it does help guide us. There's some things I can do without testing,
Yeah.
like protocols that actually can help a lot. But sometimes people need to see a test to dedicate themselves to the protocol.
Absolutely.
And it definitely informs us. I would say, I don't know, maybe 1 in 5 have parasites, maybe. It seems like it's
Yeah.
gotten less for some reason. Some people have H. pylori, some people have clearly a very leaky gut. We pretty much always see dysbiosis. Sometimes we see some good bacteria completely absent. So it just helps us get more specific, which I think can also make things, faster, like we
Yeah.
talked about. So you're not just, you've probably gone through these phases too, Lauren, where you're just seeing stuff online and you're taking it, and like you're trying, your clients kind of come to you like, it's like, well, I saw this on a blog, I saw this on a podcast, that I took this, and then years go by and they're just taking random stuff that they saw. And when it doesn't work after a few weeks, they stop it. And that just goes on and on and on.
Yeah.
So
Yes.
testing can help get us
Kind of
focused.
direct a little bit. Not absolutely necessary, but yeah, often to expedite the healing, it's helpful direction for sure. Yeah.
Yeah. And my favorite gut supplements aren't cheap. So, sometimes to put people on a protocol without testing, ironically, it's better to spend the money on the test to know, okay, yeah, I see why she's recommending these
Yeah.
expensive supplements. And
Yeah.
then it's a little bit more focused.
Yeah.
So,
I hear
yeah.
you. But it's good
Um,
clarity for sure.
yeah.
Cool.
Any other questions, feel free to ask in the chat. Maybe while we're wrapping up, I felt like it would be interesting to talk a bit about weight loss, what you do in your clinic, kind of some of the debate about Ozempic and its safety versus risk. I know I have some questions coming to my mind with, more and more people are definitely using it.
Yeah.
I know it's used in your clinic, and I don't know, I see some mixed things. So I wonder your perspective.
Yeah, I know, and I've been using it honestly more and more of late, but in more like, be it low dosing, maintaining low dosing, even micro dosing. So, okay. So question in general was more like weight loss, just kind of strategies, or should we kind of dive in GLP-1 stuff for a second?
Let's go first with that. I think
Okay.
the microdosing is one that's come up for me too. That maybe like, especially we get insulin resistant in menopause. So just explain that concept, or even explain what it is. It's a peptide, technically, right?
It is absolutely. It's totally
Okay.
peptide, and hence, we use a lot from compounding pharmacies, and often they use in combination with different products, be it like glycine or B12, to help offset some of the negative effects that you can see, be it fatigue or nausea or brain fog or things like that. But I always preface, of course we do informed consent, but talk through, you don't need to feel poorly on this product. I mean, there's no sense in pushing forward because you're noticing progress and feeling really crappy through the process. There's ways to offset that, or there's actually different versions that you can use. The Ozempic or the semaglutide was kind of the big one first brought out, and now we've been using more like a tirzepatide or the Mounjaro commercially available form. So there are different versions that I'd love to mention. Ask your practitioner about, because I've had people just with those minute changes have tremendous difference in their overall experience and results. So with GLP-1 agonists, again, like naturally occurring chemical within the gut, and you're just agonist means you're encouraging more production of, right? So the initial benefit was it's used for diabetics for insulin receptivity, like insulin resistance, and can help with, because it interacts with motility of your gut, it can slow that slightly, and that's how it is impacting appetite. So that's something to just, consider if you have like some motility issues, that type of thing, just something to talk about with your practitioner. But beyond that, what we've witnessed clinically is just such an impact on like central nervous system kind of relationship with food. There's even a lot of conversation around it affecting not only your sugar cravings, but like alcohol cravings. We've even gotten to the point where we're reminding people to make sure they're consuming fluids, because it can affect like your water intake. It's very like craving control esque. So I think the microdosing can be helpful for clientele that are just feeling overwhelmed and out of control in the just dietary cravings space, to help kind of rein that in, so you can start having more willpower and kind of feeling in control there. But we've been using it alongside other peptides and then we've been having really, really great results. Not only people feeling good through the process, achieving goal, but then at the goal, achieving the goal, being able to either wean off or discontinue entirely and maintain the results. So,
yeah, I think that's one question that comes up too. Like, how do you get off of it? Maybe one option is just go down less. But I feel like similar to some mental health stuff, it's like you can perhaps be doing a little medication support really while you build muscles and while you build healthy dietary habits. I think that's a bit of what I'm noticing now that I'm working in a different clinical setting, that people are taking Ozempic, then they're maybe losing some weight, but they are not working out and they haven't changed their diet, and their body shape, it doesn't look healthy.
different. Yeah.
No, it doesn't look different.
It doesn't look, it's just wasting. So that is huge. It's like this good and bad that's as a tool, it works, right? It's like, can be like magic for people that have been trying for so long to lose, and then all of a sudden they're dropping 10, 15, 20 like quickly. I think that the rapid weight loss can be problematic, not only for sustainability, but also for, when you start mobilizing a lot of adipose tissue, you're releasing a lot of toxins, so you can feel kind of crappy there. You're asking a lot of your liver, your gallbladder to like break down, process, eliminate that. So
that's a good point. Is
much
rapid
too
weight
fast.
loss
Yeah, rapid
healthy?
weight loss can be exciting and incentivizing, but there can be a problem with that too. So we tend to go a bit more slowly, and like you're saying, accompany it with weight-bearing activity and exercise, good amount of protein, making sure we're not squashing appetite so much that you're not wanting to eat at all, so that you can maintain like musculoskeletal health, right? In maintaining muscle, if not even building, with some of the clients we work with, you're going to be affecting like your metabolic activity. If you lose all your muscle, then you're going to be worse off than you were when you started.
Yeah. Building muscle is very, very important for aging. We tend to lose it. And, I think that's another thing we might not fully think through when we think about our goals in like a mainstream way. Like if you see someone who's older and looks good, it's not just that they're like rail thin, it's that they have muscle and vitality. So if that's not part of the goal, you're not gonna you may not get the result you think, right? Because you're not building muscle and you're
Yeah.
not building vitality.
Yeah.
So,
Yeah. And I think that's where the whole, well, you'll lose it, but you'll gain it all back. That, it's not a myth. It's not a myth. It's true, but it doesn't have to be. You're
yeah,
fine if you're
yeah.
doing it correctly. Yeah.
Well, I'm glad we're talking about this because, there is a lot of debate online, and I think it's also people not talking about it because they don't want to admit they've used it or
Yeah.
whatever. And I think a nice thing about Lauren is she's a naturopath, right? So she's not just gonna like give you this thing and no other advice. She's maybe gonna monitor the dosing, pair it with other things, make sure you're talking about your overall health rather than just like buy this off the internet type of
Yeah.
things. I think you can access it a lot of ways now.
Oh, yeah. It's pretty
So
available. And,
yeah.
and we'll have clients come in, specifically requesting, of course, because it's such a conversation right now. And we really do, we don't require, but we ask, like, let's do labs. Let's see what else could possibly be contributing, thyroid or, sex hormones,
True.
stress.
True.
Because if all of that is shifted and there's more literature coming out that if you optimize hormonal balance and other body chemistry, not only will these GLP-1 agonists work better, but you'll have more like long-standing results. So it kind of sounds like, well, of course you will, but more and more I think are getting accustomed to checking those biomarkers to address everything. Yeah.
Well, and I'll share my little story. When I first saw Lauren, like my thyroid was not managed right at the moment. And, we adjusted that and she gave me the growth hormone peptide. We got worked on iron. But the first time I saw her, she's like, do you want an Ozempic shot? And I was like, I never thought about it, but sure, I'm going to just admit it here. So I took one. Horrible experience for me. Not saying this to throw Lauren under the bus, just my personal experience. Because again, I think sometimes people are out here sharing horrible, like so much in Chinese medicine, we say food stagnation. Like my stomach was so crampy and, poor appetite and just feel like shit, nauseous. So it wasn't for me like that. And later we talked about like, my problem isn't like cravings or overeating. I think my problem was more like I'm getting into late perimenopause. My thyroid was misregulated. I needed to change how I ate macros wise. I needed to change how I exercised. And I'm going to talk more about this in my community, but like, I probably haven't even shared this with you, Lauren, but I've now lost over 10 pounds with no Ozempic, right?
You look fantastic. Yeah.
Well, you can only see this much of me.
No,
but
I saw you at brunch. I got you.
yeah. And now I'm working outside the home and I'm moving more, and like that just made me lose weight too. So I'm sharing because I felt so discouraged. I was never a person who had to fuss over my weight, and I felt like, oh, I'm eating healthy, I'm exercising. Like, what else do you want me to do? But we change as we age and we have different needs. So I just want people to know too, like, if it's a tool you're not comfortable trying, or you had a horrible experience like me, don't think like this is the only way to lose weight. It's not. It's just but it's the only thing being talked about practically right now.
Yeah.
So I just want people to know, like, there are other ways to change your body shape for sure. Or you use lower dose, or you use a different formula. So there's options out there, and I guess that's my 2 cents.
Yeah.
And if you're going to try it, I prefer you use it with someone like Lauren, who can give you a full perspective.
And if you consider too, like, okay, GLP-1, like, what is this doing? Where is it originating? What is it providing the system anyways? Like, right, glucagon like peptide 1, it's regulating blood sugar, appetite. It's acting gastrointestinally. Like, that's where I just start talking through like gut health things with my clientele too. It's like, okay, sorry, back to this theme again, but some clients we've done just heavy duty gut protocols with, and that alone has allowed for that whole internal environment to shift and optimize. And then, you'll see metabolic activity turn on. So it's not like, oh, that tool is the solution. If you can kind of get to, well, what is that tool doing? And then allow for you to just kind of let your mind think in that realm for a little bit. It opens up to, yeah, you're not stuck with just that option. There's so much that you can do. Yeah.
Yeah, it has to be a match for your
Yeah.
individual needs. Stephen, we're not going to get into that question right now because we're kind of wrapping up, but I will take a couple of these like leftover questions about the VIP and the Rose was saying some people say not to use the VIP if still exposed to mold, and if you agreed. I don't really see why not. What do you think?
I don't either. I don't either. And I mean, I understand. So you're saying if, you know, for instance, you're living in, or the exposure is still chronic.
The only real, go ahead. Sorry.
No, you go ahead. Go ahead.
Well, one thing I do say to people if they're still living in mold is I'm like, we can treat you, but as long as you still live in mold, you're not going to really fully heal. That's one concern. Other than that, I don't see how it would like kick up any problem. Do you?
I don't think it would necessarily be harmful, but the effect of might be limited. And again, not that it's this expensive product, but you know, you want to allow for whatever you're introducing to really have as much benefit as possible. So, yeah.
Yeah. I mean, if people are still in mold, I'm like, sure, do basic stuff, but save some of your budget for when you're out. You know, do a basic binder, do vitamin C, get your sunlight, you know. And again, we all have limited, you know, money at a certain point in time. Like I literally just told some people the other day, I would rather you, because they're like, we don't have the money to move, and they wanted to maybe run some kind of test. And I was like, I literally would rather you use the money to move. Like I literally rather you move than spend more money. Not to say I can't remember what test they were thinking of buying, but I was just like, look, if you only have $3,000 or whatever, and you're in a rental, I would rather you save so you can move than be pouring money into the, like, you know, I don't know, fussing around with where you're at now. So I never like harsh on people. Like some practitioners are like, I don't even want to talk to you till you've moved out. That's silly. Financially, you know, you can do that. You can spend some money on protocols. If you're in the exact same mold situation, you're not going to fully heal. So, unfortunately, I'll just take this quickly, and then we'll hop off here. Trudy was asking about SIBO. Would VIP help for SIBO? Not sure.
From a healing perspective, yes. And healing SIBO without antibiotics, absolutely. I mean, I do that on the regular. And I do offer SIBO testing, not all the time within my practice. We do a lot of like GI map and stool analyses and, parasitology and all that. So getting some direction around dysbiosis, overgrowth, lack of good flora, enzymatic activity, all that stuff is helpful. And then absolutely, there are so many different herbal formulas and natural agents that can be tremendously effective at restoring the microbiome. So xifaxan and all that are not the only go-tos for SIBO, for sure.
I suppose the VIP for the brain inflammation might help.
We'll use outside of VIP, back to the SIBO, we'll use other peptides like, you know, BPC and some of your thymosin, alpha and beta. There's different peptides that are specific for like gut integrity and autoimmune or immune modulation. So that can be something to add in with the SIBO concern as well. So VIP is great and beautiful, but there's others that might be more particular for that concern. Yeah.
Awesome. Well, thank you so much, Dr. Lauren, for being on with us today. I just put up her website here on the screen. It's blocksofhealth.com, and you can set up a little consult to see if working her would be a fit for you. She's in Arizona, but she can work with some out-of-state folks, correct?
Yes, absolutely. Yeah, especially with these tools, there's a lot of like consultation recommendations. So yeah, I see clients all over.
Yeah, and you see some pediatrics too, right?
I do.
Okay.
Yes, not a formal pediatrician, but I have my own. So I've kind of figured out what to do over the years.
Yeah, that's not as many options out there for that, so
Yeah.
that can be a great option as well. Well, thanks everybody for being live and your great questions. I'm gonna be back in 2 weeks, and then 2 weeks after that, I have a couple little lives planned. So if you're not on our newsletter, you can hop on that to stay informed. I'll put something in the post here too. If you get one of our freebies, then you'll be on our newsletter list. So I'll put my website in the chat. But thanks again, Lauren. Great conversation.
Yeah, thanks for having me. You're always so fun to chat with. I appreciate you sharing all that you're up to. It's great. So thank you.
Likewise. Okay, have a great day, everybody. Bye.
Thank you.